All right, so let me show you some of the details of how we position patients for lumbar decompression to address some of the nuances that you were just talking about. So I like to have the patient, I don't remember if your table has the same kind of breakdown, but for our table, for Chattanooga DTS, I have the patient start off centering herself right on that crease there. So go ahead and lead to center there. And then I like to stabilize this belt so it doesn't shift around as she lies on her back. So go ahead and lie back. And then for positioning here, I always touch the belt line, and the belt line should fall somewhere in this area. So we can see that it's north of where it should be by about 3 inches or so. So go ahead and scoot down about 4 or 5 inches. I tell them more than I want because they always undershoot. Good. And I like to hold the strap there so she doesn't scoot the strap down. So that's her belt line. So now it does fall somewhere in here. Really anywhere in here usually is gonna fit just fine. And then for centering, come up here. We want the straps to be like the V of her legs. The straps should mirror that and should center pretty well. I'm going to show how it's wrong. So go and lift up. So that, go back down. This is way wrong, obviously, right? Not just a little bit wrong, but way wrong. So even if it's a little off, then I like to fix it. But go ahead and stay up here with the camera. And then lift up. And then while looking down, back down. And up again a little bit. There we go, and back down. So while I'm watching here, that's when I'm adjusting it. And so for putting the straps in, I would put the, I'll go ahead and do it. So the next phase is I'm gonna put these bolsters here. Is that comfortable? I always check with the patient. And then this right here, you don't wanna pull up because it can rip these bolsters, and they're $250 a pair. So you just kind of slide it out there, make sure that it's loose. And then this set of straps, you come up and over, not just over, because then you've got some slack in there, up without rotating the patient. So you're stabilizing here, up and over, nice and snug, up and over here. Check and make sure that's okay with the patient. And then this set of straps, we're going underneath the breast, always underneath the breast. So if you're going on top of the breast, either you're coming straight across, or like you said, maybe the patient is down too low. Where they land, this should always just naturally go underneath the breast. So same thing, up and over, up and over. It should have a nice matching the hourglass figure here. And then for ours, I don't know if yours has this, but for ours, this seatbelt strap comes up. We pull it down in order to snug it up. It should indent right here a bit. That way you can tell visually that it's nice and snug. You can also pull this down. You can see that that doesn't give very much. So that's how I would address what you just mentioned as your concern. All the best.